For my case study analysis, I will be presenting on Kathy Griffin. Kathy is a 50-year-old female who was admitted to St. Luke's Hospital on 5/20, and she was diagnosed with CVA, or a stroke. Background information is important because we want to know what to expect from the patient, as well as what is normal for her age and background. This will help us identify what she needs help with and why she needs help. By just looking at the background information available, I can infer that Kathy is demonstrating signs of aphasia. Aphasia can result from a stroke on the left hemisphere of the brain where language is located, and Kathy did indeed have a stroke. Kathy also shows signs of word-finding difficulty, which is the defining feature of aphasia. She has difficulty with unclear speech, expressive communication, repeating short phrases, and confrontational naming. Again, all characteristics of aphasia. Aside from allowing us to make an informal initial diagnosis, Kathy's background information tells us what to focus on in a potential evaluation. She's never had SLP treatment before, so we'll need to introduce her to what an SLP is as well as what to look forward to. Before we go any further, we do need to ask the question, does Kathy need to see a speech-language pathologist? Yes, she does. Because she's having word-finding difficulties, this is an indicator that she's having problems with language. Therefore, she does need to see us. In her patient history, we are provided with information gathered via the Boston Naming Test in the MOCA 7.1. The Boston Naming Test is what informs us about Kathy's difficulty with word finding, and the MOCA 7.1 confirms that. In addition, we are also provided with an informal report based on observation. Kathy's difficulty repeating short phrases is an indication of struggling with auditory comprehension. This could be something else that we need to address in treatment. From the data we are given, we can make a few assumptions about what Kathy needs to work on. Things we know for sure include cognition, auditory comprehension, and verbal expression, as shown through the tests that she's taken and observation. However, we don't know a lot about some other categories, like reading, writing, pragmatics, oral and motor skills, voice, fluency, hearing, and swallowing. We either need to conduct more evaluations, or we need to contact colleagues who might possibly have this information. Specifically, we aren't equipped to deal with hearing, so we'll probably need to contact an audiologist, and it might not be a bad idea to contact a swallowing specialist. Now we need to further assess Kathy's strengths and weaknesses. My recommendation is to first conduct an oral mechanism exam. This will help determine whether Kathy has a co-occurring motor disorder that further inhibits her speech. Examples of what might occur in an oral mech exam is testing cheek strength, tongue strength, and coordination. After conducting an oral mechanism exam, I would suggest asking Kathy a few questions to ascertain her level of orientation. On her patient history, it is reported that Kathy demonstrates difficulty with cognition and memory. We need to know where she's at to better accommodate her with her treatment. Finally, I would recommend conducting the BDAE in its entirety. The Boston Naming Test is a subsection of the BDAE, but the full BDAE will give us more information about those unknown categories like reading, writing, and fluency. We want to know these categories so that we can better figure out what type of aphasia that Kathy has. And I stole this slide from the aphasia presentation because I feel it does a great job presenting the different types of aphasia and how they're categorized. Based on past experience in a clinic with an individual with aphasia, here are some treatment activities we might like to explore. For auditory comprehension, we could read a short passage aloud and ask Kathy simple questions about that passage. She could also read the passage aloud herself. Examples of passages she could read could be things she might encounter daily, like a menu or a brochure. For expressive language and word finding, the SLP could obtain magazines that Kathy likes to read, find a detailed, interesting image in the magazine, and have Kathy produce full, detailed sentences about the image. The more the better. Finally, You could have Kathy practice naming 5 items in a given category, such as flowers, names, or instruments. Of course, we want our treatment to be based on the client's strength. Unfortunately, we don't know quite too much about this patient just yet, so we'd have to wait for a full evaluation in order to specifically tailor our treatment strategies for the client. Since aphasia largely revolves around word-finding difficulties, here are some word-finding strategies that Kathy could employ. She could draw it by using pen and paper. She could act it out. For example, she might, if she forgets the word for spoon, she might motion eating with a spoon. She can describe it. She can simply pause and think about it. She could use another word, or what letter does the word start with that she's looking for. For the next visit, I would advise that Kathy continue to work on activities that will help improve her word-finding skills. Depending on Kathy's kind of aphasia, we can continue to tailor activities that will address her weaknesses. I suggest continuing the exercise with the magazine, as well as adding in some new activities to help Kathy engage. For example, we could play Uno. Each time a player plays a card, Kathy must say the number of the card as well as the color of the card. We can also assign Kathy homework by giving her a passage to read and have her answer questions about the passage to bring to the next session. I would also recommend that Kathy find a way to connect to an aphasia therapy group. Group therapy is beneficial because it allows the patient to socialize in a comfortable environment where others have the same struggles as her. She will be able to open up about her own aphasia-related issues while practicing with other adults. Some short-term goals for Kathy could be 1. To produce full descriptive sentences about an image 60% of the time. 2. To be able to produce 5 items in a given category under 1 minute 60% of the time. And 3. To be able to accurately answer questions about a passage read aloud 60% of the time. A long-term goal for Kathy would be to improve word-finding skills in the next 6 months. Of course, we have to ask the question, how will Kathy improve? As with any disorder, the prognosis depends on the severity of the cause. In this case, a cerebrovascular accident or a stroke. We can't say for sure based off of the provided patient history. However, we did learn some general information from class about the prognosis of aphasia. For example, it's likely that Kathy's auditory comprehension will improve the quickest. We also know that with aphasia, the first 2 months are often when the fastest recovery occurs. We also need to be on the lookout for changes in Kathy's type of aphasia, which is possibly in the earliest stages. Finally, I would advise that Kathy continue to see a doctor for neurological problems. In her patient history, it says that she experienced neurological changes and forgetfulness, and I think it wouldn't be a bad idea for her to continue to receive treatment or an evaluation on those issues with her brain. I would also make sure that Kathy knows that she is able to drive if her physician says that she can. She needs to know what she can and can't do. And she shouldn't be told that by her boyfriend. In summary, Kathy Griffin is a 50-year-old female client who had been stricken with aphasia after suffering a cerebrovascular accident or a stroke on 5/20. First, she needs to receive a more in-depth evaluation of her speech and language skills from a speech pathologist. And after this evaluation, she should receive treatment from a speech pathologist for auditory comprehension and word finding. We'd like her to improve her word finding skills as well as her ability to understand and remember things spoken aloud to her. Thank you so much for listening. This concludes my presentation on Kathy Griffin and aphasia.